Hi, and thank you for tuning in to I Stand with Zambia. My name is Mwansa. This channel has no political affiliation, but it is 100% affiliated with being a Zambian. Today, I want to talk to you about the disaster that's taking place at UTH in the Renal Unit. This is the unit that helps patients whose kidneys are no longer working, and so they need to be connected to a dialysis machine, okay? So what's happening? The disaster is this. Number one, they always seem to have a shortage of the 3 pieces of equipment dialysis patients need in order to be connected to the dialysis machine. The video you're looking at right now, those are the 3 pieces of equipment that the UTH pharmacy give patients for free. The staff at the UTH pharmacy are so kind, so understanding, and they are always concerned when they have a shortage of the consumables. They're called consumables. The set of them is called consumables. They're very concerned whenever they have to start rationing out bits of it. So they give you 3, that cluster of 3. They if you go for dialysis twice a week, then they'll give you 2 sets of each. If you go 3 times a week, they'll give you 3 sets of each. But when they have to start rationing, they might just only give you 1, and the rest you have to go and source for yourself. The place that we go to in Lusaka to buy it is Augusta Pharmaceuticals. Now, just the dialyzer, that one that looks like a pipe, that dialyzer is what actually acts as your kidney, as the kidney. That alone is 1,200 kwacha. Now you have people coming all the way from Istezitezi, and they have to get this every single week. And if they're going twice a week, they have to buy 2 sets. And not only that, the other stuff costs $650 a piece. It's a lot of money. And the shortage is, like I said, it's chronic and it's persistent. There's always, things will go good for a while and then there'll be a shortage. They'll go good for a while and then there'll be a shortage. This is completely unacceptable. It began during the PF administration. It's continuing now in this new Dawn government. This is unacceptable and it needs to be addressed. The head of the dialysis unit is a Dr. Mutemba, okay? Now he has issued a directive that every patient should get 3 dialysis sessions a week. That is amazing for the patients. What is the problem then? The problem is there are not enough machines and there are not enough beds. Also, the unit is quite small. You're talking about social distancing with COVID? Forget about it. There's no way you're gonna do, there is no social distancing. People are sleeping on benches as they're waiting for their turn. I'll come back to that later. So, what do we need? We need more, we need this persistent shortage of consumables to come to an end. There has to be a consistent supply of consumables all the time. Also, there must be an increase in the number of dialysis machines. There must be an increase in the number of beds. There must be an increase in the size of the unit. There might have to be an additional unit that is physically separate from the existing unit because it cannot be extended. It's on the 2nd floor. There's no way you're gonna extend that particular unit. So that unit, another unit has to be created elsewhere on site in order to cater for the so many patients that are coming in. Every dialysis session is 4 hours. Now you have people waiting sometimes for up to 3 hours. These are patients with kidney problems. They're coming for dialysis and now they have to wait to be seen. And let me tell you something. When you have kidney failure, it doesn't discriminate. It takes the old and the young. We have senior citizens there. We have people vibrant in their 30s. we have teenagers there, we have young couples there, old women, old men. It does not discriminate. When your kidney has had its time, you have to go for dialysis or you go for a kidney transplant. Okay. Now, with this shortage of beds and of machines, there's so many people who are going for their dialysis session, especially the afternoon session, the one that's at 1 o'clock. I have a loved one who I take for dialysis 3 times a week, okay? Sometimes we get there and there are people sleeping on the benches in the hallway, waiting to be seen. They don't know what time they're gonna be seen, okay? The administration in the dialysis department is atrocious. It is non-existent. And it causes so much confusion. You have nurses who are doubling up as receptionists and administrators, and they're not good ones. Some of the nurses are very kind, very understanding, very empathetic, very patient, so helpful. Some of the nurses, some of the other nurses are the complete opposite of everything I've just said. Impatient, unhelpful, rude, unprofessional. They are just a nightmare. And they take out whatever frustrations they're feeling on the job, they let that out on the patients and the family and friends, which include myself, that go to escort our loved ones. It's just not good. And in this new dawn government, one of the things that the president, His Excellency Hakainde Hichilema, is on about is service delivery, improving service delivery, good service delivery. The service delivery at the UTH dialysis department right now is an absolute disaster. There is no administrator at the front desk. There is no receptionist. There is no telephone. There is no communication into the department or outside of the department. So what do we need? We need to have a dedicated receptionist and an administrator who is going to book people in, call them to remind them of their appointments, have a phone available in case patients are not going to make it, they can call in. We have right now a situation where when you go there, you have this book and you have to write your name every single day. Every morning you go in to write your name and then you come back later when your session is up, right? But then they say, write your name down and write your phone number, but nobody ever calls you. We found out today that the department does have a telephone. They have a cell phone, a mobile phone, which is in the drawer. No one's using it because there's no airtime on the phone. There are no bundles on the telephone. Absolutely ridiculous. That is not how you run a hospital department, okay? There is no communication into or out of via telephone. You have to go there. And when you go there, you don't know who you're gonna meet. You might meet a very helpful nurse or you might meet a very unhelpful nurse. It just depends, okay? So that needs to be addressed. There are too many unemployed graduates roaming the streets of Zambia who can take up a job of being the administrator and being the receptionist at the Renal Unit at the UTH hospital.
During the president's first ever radio phone-in program, a question was read out from a member of the public in regard to the renal dialysis crisis.
So let me begin first of all with Mr. Sweden Angala. He sent this yesterday. He says, in the health sector, one of the biggest challenges we have had is dialysis for kidney failure patients. Oftentimes, consumables for dialysis have run out, leading to kidney patients skipping days, sometimes weeks to dialyze. And in the last months, especially this year, many lives have been lost due to a lack of dialysis. Further, there are a few dialysis units around the country, namely Livingston, Lusaka, Mansa, Kasama, Chipata, and Dola. Yet these machines cost less than the price of a brand new VX. Are there any plans to expand these centers to every district hospital in Zambia and also make sure that consumables do not run out where we have renal centers? So that's question one. That's from Sweden.
And this was the president's response.
I know what Sweden is talking about. Luckily, I know him. I know his situation. I sympathize with people in that situation. I know the COVID advisor is focusing on COVID, but he's a doctor, he's a medical doctor. We need to pick up this issue, please, colleagues here, and call Sweden after this conversation and say to Sweden, we agree with you. Part of saving money from the thieves, the corrupt, is to put in the health sector, as it is in education, as it is in youth programs. So yes, Sweden. But let's collaborate, because sometimes working with stakeholders, COVID advisor, drives us to solutions which are more practical and allows the limited resources to be used properly. Yes, the answer is yes.
Okay.
I'm sorry about that, but we have no excuse to make because it was the previous government. We're in government now. We have to make it happen. It will happen.
Okay.
Thank you.
Now, if anyone needs to be relieved of their duties, and I mean from the board level down to the cleaners, if anyone needs to be relieved in order for the service delivery for better service delivery to take place, for the new Dawn government to be able to deliver on their promises, then please relieve people of their duties. Okay? Zambia comes first, and Zambia deserves better. If anybody would like to speak to me, if there's any government official that would like to talk to me about what I'm concerned about, to get more details, or if there's anybody at the UTH dialysis department who would like to speak to me, you can contact me on email, istandwithzambia@gmail.com. This is the new Dawn government. We cannot accept this level of poor service delivery. It's just unacceptable. There are too many qualified Zambians who can take up the job, take up the role, and improve the service of this country. We voted for a better Zambia. We have a better Zambia. And I Stand with Zambia stands to ensure that Zambia gets the best every time, everywhere. Wherever I can lend my voice, I will lend it. Okay, so thank you so much for watching. This is I Stand with Zambia. God bless you, and God bless Zambia.